Inject. Welcome to Deuk Spine Institute's live stream. Our patient is here from California. She has sacroiliac joint as the cause of her lower back pain. She had a fusion done elsewhere, somewhere in California, and she's developed horrific pain above and below her fusion. The pain below the fusion is in the sacroiliac joints. We made that diagnosis on a Zoom call. We call it our free MRI review. She did the free MRI review. We diagnosed her pain sources, and she's here to get these ones fixed. We've already treated her. Neck. We just finished her cervical Deuk plasma rhizotomy for facet joint pain, and now we're going to shift down to her lower back and address some of the causes of her back pain. And she, like many people, she's not getting all the causes of back pain fixed today. She's getting a few of them addressed. She wants to wait on the others, and that's fine. So she picked a few that she wanted to get fixed today, and that's what we're doing. Okay, so we're going to be doing a bilateral SI joint Deuk plasma rhizotomy. Get down to the pain nerves, and we're going to destroy the pain nerves to the SI joint. Shot. So that's what I'm working on right now. Getting down. You can see the hardware, by the way, right? Everybody see the screws and rods?
Yes, we can.
Shot. Now I'm going to the most deep part of the SI joint right now. To get there, shot, we have to go through the sacral ligaments and get all the way down to the bone. Shot. If you have questions, feel free to ask me.
Yes, we have a question coming from Raj on YouTube.
All right, Raj, I'll be happy to take your question. I'll do my best to answer it.
They said, "Hi, Dr. Deuk. Hope you're well. I wanted to ask you when you must perform fusion surgeries. Is it always due to trauma, or can it be instability? Thank you as always."
Sure. Well, Raj, thanks for the question. So the reason why let's pick this question apart, because it's got a lot of components. First of all, what is instability? Instability is severe pain or neurological deficit, okay, which is weakness, numbness, tingling, that is caused by normal physiological loads to the spine. And what does that mean? Well, what it means simply is that when you just pick up something normal, like a box, or just bend over, touch your toes, you get horrific pain, right? Or you get neurological damage, so nerve damage, nerve symptoms, weakness, numbness, tingling. That is instability, period. Okay? That is the definition of instability. And instability is not a radiographic finding. Instability is a physiological finding. We're done with the left, we're going to move to the right. So instability is a physiological finding. Pain, weakness, numbness from nerve compression with normal everyday movements, okay? That is instability. Now, other people try to change the definition of instability, but instability of the spine was first defined by White and Punjabi. White and Punjabi were two doctors. One was an orthopedic surgeon. It's okay. One was a PhD, and they together came up with the first definition of. See the bone, Louise?
Yes.
See the iliac bone? Jordan, show us the iliac bone, if you can. Yeah. I think it goes a little more medial. Yeah, maybe somewhere around there. So we want to be medial to that. And your entry point is pretty good. I think it can be a little more medial. So let's see. Hold on. We're just deciding on where to enter the skin. Shot. Otherwise, it looked pretty good. I think right there is good. We want to be medial to the posterior medial projection of the iliac bone. Let me just take one more look. Yeah, I think that's good. Yeah, that's good. We're going to make our incision. Go ahead. We're treating the right SI joint. And so to answer your question, it's very important to understand that instability is not a structural finding. It is a physiological finding. But there are instabilities that are caused by trauma, such as a car accident or slip and fall. But what you have to understand is that instability does not always comes from trauma, pretty much always comes from trauma, but it may not be the kind of trauma you think, like an acute traumatic injury. For example, car accident, right? Let's say you got into a car accident today and you have a fracture of your spine. That fracture can cause pain and neurological damage, right? But let's say the fracture did not cause pain and neurological damage. Let's say there was no pain and there was no nerve or damage or spinal cord damage from your fracture. None. Okay, would that be unstable? The answer is no. But what if over time the fracture started to collapse more and shift? And guess what? Now your nerves are being pinched. Well, now that's an unstable fracture. You understand? That's an unstable fracture. So we have to address the unstable fracture, all right, because it's getting worse, and now it's causing problems that perhaps it wasn't causing before. So we have to treat it. And what can you do to treat an unstable fracture? Well, you don't want to do laser surgery if the fracture is bony or ligamentous. Our laser surgery won't work, okay? The laser surgery will not work. What works is a fusion, stabilization with a fusion. I'm in the deepest part of the joint right now, and this shot, deep part of the joint, is really difficult to get to. It's really far in there. And we call this the fibrous part of the joint. Fibrous. You could show us the joint, by the way, so everyone can see. That's it. Yeah. Shot. The good news is that as we move down towards the feet, the joint becomes more shallow. More, we call it superficial. It's not as deep.
We have another question.
Shot? Sure.
Coming from Raj once more on YouTube, asking, if you have spinal stenosis caused by thickened ligament and thickened facet joints pinching on nerves and cord, causing symptoms of numbness and pain, how would you treat this?
Okay, good. So what was, I sort of heard the question, but not entirely. If you have what?
If you have spinal stenosis caused by thickened ligament and thickened facet joints pinching on nerves and cord, causing symptoms of numbness and pain, how would you treat this?
Okay, great. So, Raj, that requires a fusion. That would require an osteotomy to remove the thickened facets. I cut them out. And to remove the thickened ligament, and then to fuse it. That's what I would do. I would not use laser surgery. It won't work. Not for that. All right. We're done. Not an easy one. Her joint's pretty deep, but I hope that does the trick for her. 2 incisions, one for the left, one for the right. Go ahead. Any questions?
At this moment, no current questions.
All right. So we did her cervical DPR, Deuk plasma rhizotomy. It's a treatment pioneered here by me. Burning of the pain nerves in the neck. And then we just finished her DPR for her SI joint. Each incision is 4 millimeters. And you can see the scars from her fusion. Okay, scars from the fusion. Thanks, Luis. There's the incision. But this is new technology. You're watching the most advanced surgery of the spine to treat pain coming from the SI joints. Remember, there are 30 different causes of back pain. There's a left SI joint, a right SI joint. They're big joints. They're where the tailbone connects to your hips. Very common cause of back pain. They are the 4th most common cause of chronic back pain. 4th. The first being disc. Second is facet. Third is piriformis. 4th is SI joint. 5th is fracture of the bone. And chronic compression fracture. So chronic compression fractures represent less than 1% of chronic back pain. 99% of chronic back pain is disc, facet, SI, piriformis. They're all curable with our minimally invasive procedures here at Deuk Spine. You won't find them anywhere else in the world. Thanks for joining us, unless there's any other questions.
No current questions.
Everything went well. We have one more surgery to go, and then we'll be done. So tune in about 30 minutes.